Hi, good evening, everyone. Good to be with you. Thanks for the kind introduction. So before I do the full story of AKS Khan Pharma, where I'm an investor, shareholder, board director, I want to do a little dive into something else, which is how did I end up here? I think next week is the 10th anniversary of my first ever trip to Bangladesh, where I came as part of a delegation from BAPI, who are a global healthcare company. I was the director of global business development there. We launched digital healthcare products in 12 countries, in Ghana, in Chile, in Spain, in Australia. And we had a potential joint venture with Telenor to launch Tonic that was mentioned kind of earlier. And so that was 10 years ago, kind of next week. But my journey, this kind of weird journey, where I've ended up being an investor in many Chinese companies, Bangladesh companies, in healthcare and climate tech. How did I end up here? And there's kind of one or two photos that probably should be on this slide and are not here. So my two grandmothers. So when I graduated, they came to my graduation ceremony, kind of age 21, and they gave me some personal and career and life advice. And my English grandmother, she said, you know, whatever you do, whatever jobs you choose, whatever career you choose, it should be something that does good, it should be something that is impactful, and it should be with organizations that deliver something for the people. So that advice to me, age 21, like I've tried my best to live up to what my two grandmothers, who both said the same thing, wanted. And this journey of, you know, launching healthcare in 10 countries. In PepsiCo, we did functional foods. We launched fortified cookies, fortified Quaker oats in 10 countries. So many of the things we've heard today, been involved in kind of personally. And then actually the Tonic story was interesting. So, you know, we did launch that business with Telenor. I ran the operations. We had maybe 2 million digital doctor consultations over 4 or 5 years. We paid maybe $1 million in health insurance claims. I think it lived up to social business in that it was very social, but not entirely a business. So I think good health impact. And then the last couple of years, so the AKS Khan story is part of my investment portfolio. So I invested alongside Samanzar Khan and her father in the business a few years ago. We've been scaling it. And I think it's probably the most exciting one of all of the companies that I'm advising and investing because of the potential to change healthcare in Bangladesh through a pharmacy-first model. So the title that Jamur, our CMO, asked me to talk about is from purpose to progress. So how are we taking the company's vision and mission and actually deploying it in real services to real patients across Bangladesh. So from the Khan family, the kind of vision for this business very clearly is world-class healthcare, bring international SOPs, international standards, international technology, international advisors, but it should be for the people, so not for Tri-State, not for Gulshan. It should be for real people, real middle class in real Bangladesh. And it should be from the heart with great empathy, great customer service, doctors that give you the time that you need, not 15 seconds, but 5 minutes. And it should be quality diagnostics. So every test should really be done, not giving a customer a fake result based on no real test taking place. The medicine should be authentic. They should be verified. They should be temperature controlled. Everything that would mean the medicine would actually work. And the medical advice should be accurate. So whatever our doctors, our nurses, our pharmacists are saying, it should be according to international or national SOPs, and it should be correct. And we've got the ambition to reach to 20 million families over the next 5 years. Today, we're serving about 1 million patients per year through our network. So the problem that we see, and it's similar to the way that others talked about the problems in Bangladesh healthcare earlier on today, lack of authentic medicines. So the fact that perhaps 1/3 of all medicine out there either doesn't have the right active ingredients or it's just fake, it has no active ingredients at all. The accuracy of diagnostic services. So is it the right reagents at the right temperature? Is it the right results being given to the right patient? And we see a huge problem on the lack of trained doctors, trained pharmacists, that out there in much of Bangladesh, it's people with at most a first aid certificate who are giving people advice on quite important health issues, and it's not good enough. And then finally, the lack of empathetic service, doctors that don't give patients the time, that don't listen to them, and if you don't listen to your patient, your advice to them is not going to be correct. Maybe it'll be a 50-50 chance that you've actually diagnosed the correct health issue of that patient. So all of those problems really causing a huge gap in access to quality healthcare in Bangladesh. So our solution is to go pharmacy first. So already we have around 38 pharmacies across Bangladesh. A year ago it was 13, so we've trebled in a year. We've launched our first 5 walk-in clinics and diagnostic centres in Kamrangachar in South Dhaka a few weeks ago, our first 20,000 square foot diagnostic centre, and 4 other clinics in the last 6 months. And we secured a big investment recently that will see a very large scale up. So where we are today, those facilities, but importantly, 250,000 patients being served every single month. So this is already big scale, big sustainable business. And I think we've got a short corporate movie that our CMO prepared that hopefully someone can now play on the AKS Khan Pharma business and story. Whoever needs to play the video, please play the video. Okay, let's not have the video. Our solution, what are we doing through the physical network? So a pharmacy-first ecosystem where we are using quality doctors, quality pharmacists with SOPs to train them and give the right medical advice every time. We've got a full supply chain traceability where every medicine is being tracked to its original manufacturer. We've got 100% health data. So every single interaction between a patient and our doctor and our pharmacist is captured in our EMR. I think so far we've got perhaps 2 million individual patients with health records in our system. We've got integrated care flow. So if a patient comes to our pharmacy with diabetes that they're struggling to manage and they need a diagnostic, we'll manage the referral within our network. If they need to go for a surgery or procedure that we don't offer, we have partnerships with many of the top hospitals to refer them kind of on. And importantly, we think there's a huge gap for female-friendly service. So in 100% of our pharmacies, there is a female pharmacist. In all of our diagnostic centres, there is a GP doctor who is female. So providing a kind of safe environment for all of the female patients of Bangladesh to come to our solution. And what we're busy rolling out over the last 6 months is a whole series of technology-enabled services through all 38 pharmacies, all 5 diagnostics. So AI diagnostic devices where someone is coming to our clinic for an X-ray, for an ultrasound. They don't only get the expertise of the specialist doctor in our centre, they also get an AI check on the result, which is usually a database of 5 million, 10 million, 15 million medical records. So it's the best international data being used to support someone in South Dhaka, in the outskirts of Chittagong, not just the opinion of kind of one doctor on their own. We're also launching medicine subscription services for those that have chronic conditions, so diabetes, heart disease, respiratory conditions. So again, someone can have a free medicine review from our pharmacist, from our GP doctor on, is this the right mix of medicines for you? And that is also leveraging AI to kind of second guess and check, is this the best set of prescribed medicines that could really be used for that patient? Or are there any contradictions, any risks, any side effects that could be there in the medication? And what we're building is really flowing patients through that entire ecosystem from our large diagnostic centres to the walk-in clinics and residential area and to all the pharmacies. So that there's one view of the patient and one medical record and helping the family really manage the care for their elder parent or for their husband, wife or child. So impact till date, the last 4 years since we launched, so already 5 million authenticated prescriptions served. With the right medicines, no giving antibiotics to patients that don't need it, all medicines quality checked. 70% of our customers are female, so really serving that need very nicely with respect and safety. About 1/3 of the medicine purchases are chronic patients. So really making sure that they're looking after their heart disease, their diabetes, and as I said, 100% of all the consultations and medical experiences, data in the EMR, so that we can then refer different services or double check it was the right prescription that was given. And importantly, who are we serving? So, if you look at Dhaka, within 3 kilometers of our branches here, it really is about 5 million people in this lower and middle income bracket. So we're not focused on upper middle income. They have very good services within Tri-State already. This is about serving the people who, have quality aspirations, but perhaps their income as a family is not yet too high. So examples would be our last 2 diagnostics that opened in Kamrangachar and Sonargaon the last 8 weeks, 9 weeks. Very dense residential area, huge, tens of thousands of families in the lanes nearby, and now giving them quality ultrasound, quality x-ray, quality gynae advice, quality cardiology advice, without them having to travel from their residential kind of area. And then on our data, so very structured organization so that we can really give patients the best medical advice. So centralized storage. We've got the same medical data protections that HIPAA would require in the US or the EU. We've got everything in standardized protocols, and then real-time alerts. So if a doctor is giving a prescription that the system thinks is not appropriate, it's alerted in real time, and there's an intervention to give an extra bit of medical advice from that doctor. We were very lucky in January, we received a large equity investment from the Danish government. So from IFU, who are the Social Impact Fund of Denmark, they invested $12.5 million in January with a further $10 million coming. And that's to roll out 100 pharmacies, 30 diagnostic centers, and go from 1 million patients per year to 5 million patients per year, and take us from $15 million per annum revenue to upwards of $100 million of revenue. So this is to be quality healthcare for the masses, but actually a very scalable, sustainable business that can reinvest in patient services. Our next opening in May in Chakuria, just north of Cox's Bazar. We're heading there this weekend to check on progress. It'll be another 25,000 square foot. And you can see what we're aiming for is, even though it's for the normal middle class of Chakuria or Cox's or other locations, it should feel like they've got the quality of Singapore or Bangkok. That the physical environment, the consultation rooms, as well as the style of the doctors and the way that data is captured, you should feel like you're in Singapore or Bangkok, but you're getting it at Bangladesh prices, Bangladesh locations. And then what's also coming next month? So we'll be launching the first home X-ray, home ultrasound with AI analytics. So this is in partnership with the Korean government, with some Korean professors and other support from Korea. And really this is, for an elder patient in their home, we can now, and they've had a slip or a trip or a fall, we can now send our doctor or care advisor to their home, do the X-ray, do the ultrasound. The results are checked against the 10 million patient database from Korea, which is also being used in Harvard and the US medical system. And they can access all of that from the comfort of their home in Bangladesh for under $5. So it's making quality healthcare truly accessible, leveraging world-class technology and bringing it to ordinary people of Bangladesh. And what you'll see on the kind of the X-ray is basically 99% accuracy from the AI tool. So it's not just the view of our visiting, physician who's going out to see the patient or our specialist. Everything is being sense-checked and double-checked to make sure it's great advice as well as being, a few dollars of cost. So to wrap up, we have a big mission ahead of us to go from 1 million patients per year today to 5 million patients in the next 2 years using the Danish investment, but really to get to 20 million families all across Bangladesh so that, like many other of the AKS Khan family companies, we really change the landscape of a sector by bringing international technology and expertise to play. So thank you all. I think maybe I'm keeping us from dinner, so I will stop. And any questions, very happy to take now or after, but thank you. Any questions or just dinner? Oh.
Yeah, so my thing is, you talked about these diagnostic centers and originally you talked about a problem that doctors are not giving enough time or not being able to give time to the patients. So what we see in Bangladesh, it's sort of like when you are talking about a hospital or a particular medical facility where there are many patients, doctors are not really having time to give enough time to the patients. And when we are talking about the higher up people, like upper level or upper class, okay, fine, probably one particular doctor is probably giving a hell lot of time to one patient, but because that particular patient is giving, okay, a premium charge or premium fees, that's why he or she is getting a premium type of time. As your focus is on the middle class consumers or probably even down below, how do you ensure that your particular facilities, the doctors there, even in a rush period, are giving enough time to the patients, the time that demand and deserves?
Yeah, a really important question. And the truth is, if a doctor is only giving a patient 15 or 20 seconds, it's entirely based on the papers they read before, and it's based on their past practice. It's like they're a human algorithm. It's not based on talking with the patient. It's not based on listening to them. So our model is, in all of our centres, there are salaried, employed GP doctor, salaried, employed specialists, gynae, paediatrics, cardiology. So as well as the visiting star doctors, which everyone needs to have because that's what some patients believe is the answer, we think the real answer long term is to have doctors who are actually on a salary, part of your ecosystem, and then you can manage it differently because we've set them very clear KPIs, which is you have to give every patient 5 minutes. You can give them more, but it has to be at least 5 minutes. We're not allowing in the system for you to book more patients than every 5 minutes. So and we're paying your salary. So we want you to really listen, really capture every possible insight from the patient about what their health issue is, and then give them really informed advice. And I think our thought on the business side of it is those patients will then come back month after month, year after year, their family will come. That's a real long-term business, whereas just a prescription factory where every 15 seconds you're signing and signing and signing, it's not real healthcare, and it's not a great long-term business. It's a good short-term business, but it's not a good long-term business.
Yeah. Thank you.
Any other question? No. Last chance. Oh, there is one.
In fact, I have two questions. The first one is that are we going to see AKS Khan Pharmaceuticals as a pharmaceuticals manufacturer in Bangladesh anytime soon? The first one. And the second one is that do you have any number in mind in terms of outlet numbers, the pharmacy, that you want to hit? Do you have any numbers in mind?
Of stores?
Of stores, yes.
Yeah. So on the first question, so to be honest, like the quality of the pharmaceutical manufacturing sector in Bangladesh is excellent. I mean, there are many, many good players who are not just, investing in manufacturing and delivering lower tier medicine. They're actually developing quite advanced, cancer therapies. They're actually doing a whole lot of very innovative work. So we don't think there's a huge space for, a new pharma manufacturer that does a great sector. I think where we think our opportunity is to distribute those medicines and follow up so that patients can adhere. Because, today there's no lack of access to medicines physically, but helping a patient follow them up, manage them, take them properly in the right conditions, manage their condition is the opportunity. On number of outlets, so we've got the investment to open 100 pharmacies. We think there's probably scope for 500 or 600 across Bangladesh. If you look at next door to India, the 2 or 3 largest retail chain pharmacies, Apollo have 11,000 pharmacies, 1 or 2 others have 10,000, 15,000. But obviously their healthcare sector is already a bit more structured in terms of, chains of diagnostics and chains of pharmacies everywhere. So there's definitely scope for hundreds with the kind of reach. I think. But there is a limit on kind of rural Bangladesh to have those structured, organized pharmacies with model pharmacy. So we think there's probably different models there. And some of what Shukhee showed is interesting on how do you use the existing infrastructure that is there in rural Bangladesh, but put some quality into it. Real doctors, real prescriptions, etc.
Yeah. Thank you.
Any last question or? Finish. Okay, good. Thank you, everyone.